Good day, gentle people. This is In Sickness and in Health, Week 3 Storytelling. As a provider of care, a physician assistant of 30 years, I know that many times I have said to a patient one of the following: I don't know what it is, but we will find out together. Or, you've had it for 4 years and it hasn't killed you yet, so it's not cancer. Implying that while I had no clue as to what it was, I did know it was not cancer. Or, I can tell you what it's not, but we don't know why you are having XX. I think as we begin our journey into the philosophy of Hippocrates and medicine in general, there will be many exemplars of how the goal of Hippocrates to do what is right for a patient, in his opinion, and how medicine is really not infallible will emerge. I want you to take the opportunity to share stories as I am to illustrate your opinions on what you are reading during this cluster. Just leave out the real names. Now, if you look on page 16 of Hippocrates' Shadow, quote, Hippocrates did not see the field of medicine as a storage bin of ultimately knowable facts and figures, and therefore he neither pretended nor aspired to be all-knowing, unquote. Despite this start, consistent with Hippocrates' day, medicine today has a completely different flavor all too often. The doctor, the PA, the nurse practitioner, the physical therapist, the professional is given an automatic pass to way smarter than the rest of us, by virtue of their education and the rarefied language of medicine that most of us do not know. I remember when my mom called, and she told me that her breast was swollen, that her skin was getting thick and slowly turning orange. In my mind, the "oh my goodness" was triggered in my head. Calmly, I asked her about her mammogram and what the doctor said. I was in California, and she was in Texas. She said, my mammogram in September was normal, and Dr. X says it's just a bruise, that your dad must have hit me by accident. This was late October, 6 weeks after her mammogram. My mom, like so many people, trusted the technology, that's chapter 2 that you read this week, and had placed a stamp of unconditional trust in her physician. My first call was to an IGEN physician of my acquaintance in my mother's hometown, and we got her in to see the oncologist the next day, which, by the way, was Christmas Eve. She had her mastectomy 1 week later for totally out of control metastasized breast cancer. So like Beatrice in the book, the mammogram in September was not flawless, and the doctor was even less so, because he relied on the mammogram instead of the patient. He did not look at my mother's breast and say, oh my goodness, like I thought, and he did not listen to her words that my father didn't accidentally kick her in bed. Hippocrates would have been very disappointed. The list of things that we in medicine practice at, and those which we have not really defined, is much too long to discuss here. But there are some common ones that you will recognize. Fibromyalgia, irritable bowel syndrome, low back pain, headaches, funny red rashes that come and go, skin tags in areas where there are no injuries, nervous stomach, and my favorite for all children, growing pains. And there are very, very many more. A dermatologist of my acquaintance years ago, that means he's a skin specialist, told me that if I, a PA, could not identify a rash in 6 seconds, that he, a dermatologist and a specialist, probably could not either. Reassuring, yes? No. Providers of medical care run on experience, experimentation, and the law of averages. The law of averages says that the sneezing, runny nose, sore throat, and dry cough without a fever is a viral cold, an upper respiratory infection in doctor speak. But it could easily be the early changes of throat cancer, severe allergies, H1N1. The differential diagnosis list goes on forever. A differential diagnosis list, for you who don't know, is a list of all the diseases and conditions that could present with something fairly simple. Let's just take abdominal pain. There's currently 513 reasons to have abdominal pain. Headaches is another lovely differential list, 276 at my last count. So, in medicine, we have a couple of sayings that go to what is normal is normal. Don't look for zebras in a herd of horses. And common is common. On the other hand, we have a saying for things that show up with certain symptoms or findings, like my mom's breast cancer. What she had was pied d'orange, which is French for orange peel, the changes of the skin secondary to cancer. That one statement on the phone, I knew and said in my head, this is cancer until proven otherwise. So we have these little footholds and little tiny places where we put the signs and symptoms that our patients tell us, and we either say, don't look for zebras, or we say something really scary like, it's cancer until proven otherwise. And that is all a way of saying that medical personnel, for the most part, are guessing based on experience, some knowledge, and the law of averages. While providers of care struggle to understand the science and the interactions of the human body, they find that on a daily basis we really don't have much defense against so many things. My favorite commercial, is the commercials for the medication for genital herpes. There is no cure for genital herpes, or any herpes in general, period, or the common cold. We do not know how to solve one of the most common things that almost every person on the earth gets, and that's viral illnesses. A person goes in for a simple surgery and dies of a blood embolism that shouldn't have formed but did. CPR seldom works, but occasionally it does. Medications work well to control infections or depression until they don't work anymore on you, but they still work fine in me. It is a puzzlement. As we continue on the path of learning about our bodies, how we look for and receive medical care, and the actual dominance of germs over the human race, think about how you approach your own medical care. Do you trust implicitly or not? Go forth and study. Thank you.